What's up, guys? It's Dr. Jim. I am your CBD expert, your natural healthcare expert, and your worldwide virtual health coach. And I want to welcome you to tonight's live. Tonight's going to be awesome. Tonight's topic is CBD oil and chronic stress. Now, here's the question. Does anybody out there have chronic stress? Not a chance, right? Nobody has chronic stress. Well, I'm going to talk about it in a little different way that you maybe never heard of before, but we're going to be talking about CBD oil and chronic stress. So I'm also going to try to keep this concise, short, and to the point. I've been talking a lot on these videos, and I'm going to try to make this quick so that you can get as power-packed as fast as possible. So when you're getting on, if you let me know where you're coming in from and whether you're watching it live or on the replay, because I want to know, are you getting the full energy of Dr. Jim live? Are you watching it on the replay? But either way, tonight's going to be awesome. Tonight's topic is CBD oil and chronic stress. All right? Now, the disclaimer for tonight is I'm not your doctor tonight. You are not my patient tonight. And there's absolutely nothing about this video that constitutes a doctor-patient relationship. So please don't change anything about your current medical treatment because you heard me talk about something cool on this video. Second, CBD oil is a natural supplement. It is not a drug. Therefore, it is not intended for the diagnosis, treatment, or cure of any specific condition, including anything that we talk about in this video tonight. So, tonight's topic is CBD oil and chronic stress, right? What a big topic. Who here has chronic stress, all right? You can just put a thumbs up emoji in the comments if you have chronic stress. I know who you are when you're out there, all right? So, chronic stress. Now, here's the thing. A lot of people talk about chronic stress like, oh, yeah, I got chronic stress. But I want you to understand how serious chronic stress can be to your health. And I'm probably going to talk about it in a different way than you maybe have heard before. Yeah, there come the thumbs up. All kinds of them, right? So, chronic stress has been linked to many significant conditions. So things like heart disease, high blood pressure, diabetes, obesity, reduced immune functions, sexual dysfunction, GI problems, skin problems, autoimmunity, insomnia, anxiety, depression, all of these can be connected to a problem known as chronic stress. So I don't want you to just think of chronic stress as like this inconvenient feeling you have. It literally has serious health concerns. I mean, high blood pressure, diabetes, obesity, right there is like 2 of 3 top killers in the United States. So chronic stress is linked to very serious problems, okay? And I'm going to talk about it a little different because most of us think about just one type of chronic stress. And I'm going to actually talk about 3 different types of chronic stress that may be driving this for you. Number 1 is the one we all tend to think about with it, which is sort of mental and emotional stress. Now, that mental and emotional stress can come from things like, your job, it can come from relationships, it can come from finances, it can come from sitting in traffic and being aggravated by the people in front of you. It can come from dealing with annoying people, right? So mental and emotional stress is the one we all kind of understand, and those are the things that it comes from. The second type of stress or giant causer of chronic stress is called metabolic stress, all right? Now, if you understand it, it's mostly from kind of what we're putting in our bodies. And that can come from a lot of different places, from our environment. So the air we breathe, the water we drink, and the food we eat. And the food we eat is probably the biggest one. You eat too much sugar, if you eat too much gluten, if you eat a bunch of processed food, if you eat lots of hydrogenated fats, like all of these put metabolic stress on the body. And if you know, all those metabolic stressors can create all kinds of problems, just like what we talked about there. So these are chronic stressors, literally that metabolically there's stress on the body, all right? And then the third leading cause, or the third major driver of chronic stress in the body is pain and inflammation, right? So people who have serious injuries, people that have tons of like arthritis, autoimmune conditions, and you're going to see that there's overlap, right? Because, we talked about that like certain, autoimmunity can drive inflammation. Inflammation drives mental and emotional stress, and it all just sort of works together here. But the third cause of chronic stress is something called, it's the pain and inflammation. And when you have chronic inflammation, it is creating a stress in the body, or pain, right? So now, what do these three things, mental and emotional stress, metabolic stress, and pain and inflammation, those three stressors, what do they have in common that's ultimately creating this chronic stress response in the body? Is that all three of them activate the two major stress hormones. And the two major stress hormones are adrenaline and cortisol, all right? And we know that if you have elevated levels of cortisol and adrenaline over long periods of time, the health consequences are really, really serious, because they will lead to autoimmunity, diabetes, obesity, skin problems, gut problems, all of it, right? And so these drivers of chronic stress then elevate your stress hormones, adrenaline and cortisol, and both of these, all right, both of these things will create a serious health concerns on the backside. So this is what I want you to understand about how does CBD oil factor into this equation. Well, number one is, if we know that these three main stress drivers, the two big things they elevate are adrenaline and cortisol, and that long-term exposure to those cause all these health problems, well, guess what CBD oil has been shown to do? At the very least in animal studies, is it has been shown to help reduce cortisol levels, all right? When there's a stress response and there's an overstimulation of cortisol, CBD has been shown to be able to reduce cortisol levels. When there's too much adrenaline, CBD oil has been able to help reduce adrenaline levels, all right? So if you can reduce the top two drivers, the two hormones of stress, then you're helping lower your chronic stress levels. And if you lower your chronic stress levels, then you're having a positive impact in all those health conditions that are connected to chronic stress. But let's take it back like a step further, kind of more upstream, right? Because what's driving those two hormones upstream are the mental and emotional stressors, the metabolic stressors, and the pain and inflammation. So let's see how CBD oil can actually, not only does it impact adrenaline and cortisol and help lower those, so that helps lower chronic stress, but it actually goes upstream and it can have an impact at the higher level. So CBD oil, when we're talking about mental and emotional stressors, right? Well, one of the cool things that CBD oil does is it helps bring balance to our neurotransmitters. All right, neurotransmitters are all those things in the brain that either cause excitation or cause things to calm down, make you feel good, sort of sometimes make you feel bad if you don't have enough of it. So one of the things that CBD oil does is it activates the 5-HT1A receptors, which are your serotonin receptors. And we know that serotonin is a neurotransmitter that helps bring kind of makes you feel good. It helps regulate a lot of sense of well-being and feeling good. And so being able to activate that 5-HT1A receptor has a positive impact on your neurotransmitter balance and feeling good. And when you increase that, it reduces mental stress and emotional stress because you have positive serotonin numbers. Number two is it helps activate and stimulate the GABA receptors. Now, GABA is a neurotransmitter. It is the premier, the number one calmer downer, for lack of a really good scientific word. It is the premier calmer downer of your neurotransmitters. So glutamate causes things to get excited and overfire. Or not necessarily overfire, but fire. And then GABA is what modulates that and keeps it from overfiring. And CBD oil actually increases the affinity of the GABA receptor to attach to GABA. So GABA binds more easily and you have more of a GABA effect, which helps calm things down. So if you're having elevated chronic stress from mental and emotional things going on, your job, your finances, your life is kicking your butt and it's driving you crazy and you can't sleep and all those things, well, guess what? CBD oil helps activate the 5-HT1A receptors, which is your serotonin receptors, which serotonin, we all know, most of the medications for anxiety and depression are SSRIs, selective serotonin reuptake inhibitors, so they help increase the amount of serotonin in the brain. So having your receptors more receptive to it would be really good. It helps stimulate the GABA receptors, and GABA helps calm down your neurotransmitters. Also really important. So we can move upstream of cortisol and adrenaline, and we can actually have a positive impact at the neurotransmitter level when we're dealing with mental and emotional stuff. And that's why CBD oil is awesome, right? Number 2, we talked about metabolic stress. Now listen, you can't just keep eating sugar and garbage all the time and expect that CBD oil is going to overcome that metabolically. However, one of the really cool things in the research that CBD oil has been shown to be able to do is that it's been shown that it actually may be able to increase the number of mitochondria in the cells as well as increase their efficiency. Now, the mitochondria are how your body actually turns food and stuff into energy. And so if you can improve your metabolic capabilities, then you actually help reduce metabolic stress. All right? When your cells can't produce energy, then your body has to produce stress hormones to make up for the energy your cells can't make. So when you can improve the function and the number of your mitochondria, then that's going to help out with metabolic stress, which is awesome. And then the third thing is in pain and inflammation. Well, we already know one of the number one reasons that people get into CBD oil, check it out, is because CBD oil has been a proven track record of being very positive for inflammation, right? CBD oil has been shown to interact with CB2 receptors, and these are on the immune cells, and it helps reduce inflammatory cytokines, and it helps upregulate what are called T regulatory cells. So these are the part of the immune system. Inflammatory cytokines are what tells your body to make inflammatory products. So if you can reduce inflammatory cytokines, you make less inflammatory products. That's awesome. Number 2, if you can upregulate the T regulatory cells. T regulatory cells are the immune cells that kind of, they're sort of in charge. They're like sergeant immune cell, and they're telling everything like, all right, you calm down, you come up, and you create balance. So by stimulating the regulatory cells, it helps the immune system react appropriately. And that's all we want. We want just an appropriate reaction of the immune system, not an inappropriate or an over amount, because that long-term is chronic inflammation. Chronic inflammation leads to chronic stress in the body, and chronic stress in the body is an elevation of adrenaline and cortisol, and all of that leads to all those health conditions we talked about when we started. Now, one other thing. Well, I'll do it when I recap. So, how does CBD oil have a positive impact in chronic stress? Well, we talked about the 3 kinds of stress: mental and emotional, metabolic, and pain and inflammation, right? And we know that those 3 things create adrenaline and cortisol, and all of those long-term have a negative impact in your health, whether it be from diabetes, high blood pressure, high blood sugar, obesity, autoimmunity, gut problems, skin problems, all of that, right? Now, here's the thing. So CBD oil helps reduce adrenaline and cortisol from the stress response, which helps with chronic stress. It's awesome. But then we can move upstream, and we can actually have an impact at the causers. So mental and emotional stress, it helps with serotonin receptors, it helps with GABA receptors. All really important. The one thing I forgot to mention, which this is really awesome, is it inhibits the FAH enzyme. That is the enzyme that breaks down anandamide. Anandamide is our natural joy bliss chemical. All right, it's already, our body makes it. And anand means joy and bliss. So this is the joy bliss chemical in the body, and CBD oil helps block the enzyme that breaks it down. So if you can improve serotonin receptors, improve GABA receptors, which helps calm everything down, and you can increase the amount of anandamide, the joy bliss chemical, floating around in your brain, do you think that would have a positive impact on your mental and emotional stress? Absolutely. And if you can reduce that, then it's going to have a positive impact on chronic stress. Number 2 is metabolic stress. The impact that it has on the number and the efficiency of the mitochondria is awesome. And the third one, pain and inflammation, it helps reduce inflammatory cytokines and helps increase regulatory T cells, which helps modulate the immune system. These are the three different causes of chronic stress. Those are the different ways that CBD oil helps improve chronic stress through all of those, as well as, listen, the end product of all three of those is adrenaline and cortisol. And we have research that shows that CBD oil helps reduce adrenaline and cortisol. So you can have a positive impact in all of those health conditions because of it, which is awesome, right? Now, couple things. If you got some benefit from today's video, just give me a thumbs up. I hope you loved it. But this is what I also want you to do. I don't know how long, listen, the world is going to YouTube. I'm just saying it. The world is on YouTube. My son doesn't even watch TV anymore. Everybody only watches YouTube. And I post almost every single video that we've ever done on here. I've posted over on YouTube, on my YouTube channel. So if you want a quick reference to find any video, you don't have to search through this Facebook thing. You can go to my YouTube channel and just look at it there. So what I'm going to ask everyone to do at the end of this video is to go to my YouTube channel, Dr. Jim Holland. Go to my YouTube channel, subscribe, and then I want you to hit the little bell icon so that you get notifications every time we upload a new video, because it might be something that you want to share with someone else and maybe they don't have Facebook, or maybe it's just something, I do other videos over there that I don't do on this page. And if you're interested in health topics, you're interested in the kind of information that I'm sharing, then you're going to want to subscribe to my YouTube channel so that you will also be able to get all that information. So please go over there and subscribe to my YouTube channel. Now, if you would like the CBD oil that I recommend, all right, then what I want you to do, because listen, there's a lot of garbage out there, and I have vetted what I consider one of the very, very best CBD oils out there. It's made in the United States. It's CO2 extracted. It's every batch is tested. It's completely transparent. I mean, the test results are on the website, right, of everything. All right. So if you'd like the CBD oil that I recommend, I want you to put info in the comments. When you put info in the comments, in your messenger, you're going to get sent a message, and you can click on it and you can order the CBD oil that I recommend from me. All right? And when you order from me, you get me. You can ask me all the questions you want. But this is what I also want you to know. If someone else sent you this video, by all means, get your CBD oil from them. All right? I'm just telling you, if you don't have anybody to order CBD oil from and you'd like to ask me questions, I can help you, then please put info in the comments and I would be glad to help you, and you can order CBD oil from me. Also, listen, this CBD oil business is growing dramatically. And if you'd like to be a part of it with me, if you'd like to partner with me in this, the videos that I do get 7,000, 8,000, 10,000 views a week. So if you'd like to be a part of that, if you think I could help you grow in this CBD oil business, then put info in the comments and you can be on my team and we can work this business together to be awesome, all right? So I highly encourage you to do that. If someone else sent you this video and they've been asking you to be on their team, be on their team. Listen, I'm not trying to do that to anybody. I'm just letting you know, if you saw this video out in the world and you're like, man, I'd like to be a part of that, then put info in the comments and you can be on my team, all right? And then lastly, I realize that there are a lot of you out there that are suffering with the things that I talked about, with chronic stress. And maybe you have heart disease and high blood pressure, and you have diabetes, or you have obesity problems, or GI problems, skin problems, autoimmune problems, anxiety. If you have any of those, all right? If you have any of those and you would like my help in addressing those specifically, not in broad generalities, but like individually, you and me working together, then I'm gonna tell you that I am in a collaboration right now with a group of medical doctors, and we are doing a test right now that is like nothing else in the world. There's nobody else doing this. It is a test. It's a metabolomic blood and urine test, and it will literally test at the cellular level every metabolic breakdown you can have. So all those metabolic stressors, yeah, we know every single one of them with the test. And if you know every single one of those, don't you think you could fix it? And if you could fix it, don't you think you could overcome autoimmune conditions, overcome GI problems, overcome skin problems? Absolutely, right? So what I'm going to encourage you to do is, if you would like more information about this test and possibly working with me directly on your health conditions, then what I want you to do is I want you to put info in the comments, because what I'm doing is tomorrow night, all right? This is Monday. Tomorrow night is Tuesday. I am doing a free webinar about this test and how to overcome autoimmune and chronic health care conditions and lose 20 to 40 pounds all in 90 days without dangerous drugs, without a bunch of fad diets and a bunch of useless supplements. All right? So if that's, now, here, I want everybody on this video completely up front. It is not a CBD oil webinar. All right? This is, I hope everyone I would encourage everyone who wants to do what I just said, take CBD oil. If you want to overcome autoimmune conditions and chronic health care conditions and do all that, I highly encourage you to take CBD oil, because it's just really good for you for all the reasons that we talked about already. All right? But if you want to know more about this test and working directly with me, then I want you to put info in the comments. And when you do that, in your messenger, there's going to be a link to register for the webinar tomorrow night. Please get on that webinar. The results that we're seeing with people, I mean, with Crohn's and ulcerative colitis and rheumatoid arthritis, you cannot believe the results that we're seeing. It's crazy. I mean, I wouldn't believe it. I got into it because of the possibility of what I thought could happen, and the results are 10 times better than I thought would be able to happen. Absolutely, Holly, yes. Go ahead, register for the webinar, all right? Because a really cool thing, we talked about how CBD oil works with your neurotransmitters. The testing that we're going to be talking about tomorrow, that test actually tests how it tests the balance of your neurotransmitters. Your dopamine, your adrenaline, your serotonin, your GABA, all of those. And so you get to see the balance of your sort of your stress neurotransmitters versus the neurotransmitters that calm things down. So if you have anxiety, 100% you want to be on there, because there's a lot of reasons you might have it, and they may not have anything to do with, they may not have anything to do necessarily with just neurotransmitters. You could have a gut problem that's, 90% of your serotonin is made in your gut. So if you have a gut problem, which we would find on this test, by fixing that gut problem, that may be the thing that helps interact with your anxiety. All right? So what I tell everybody is, the most important thing I want everyone to understand is, you don't want to spend your whole life trying to treat diseases. All right? What we're going to do is, by doing this test, we are treating the individual, you specifically. And when we treat you specifically and get you healthy, then all those other things go away. All right? You're never going to heal anybody by trying to shoo darkness out of the room. The way that you heal people is that you add more light, and that's really what we do. All right? So that's about all I have for tonight's webinar. Thank you guys for getting on. Please remember, go subscribe to my YouTube channel. Put info in the comments if you would like the CBD oil that I recommend, if you want to be on my team, and if you would like more information about the webinar and this amazing new test, put that in the comments, because I would love to work with you on all of that, all right? So just like I tell my son every day before he goes to school, be your very best today. Hashtag never quit, and I believe that God wants the very, very best for you, and the day you believe that could change your life forever. Have an awesome, awesome night.